Welcome, everyone. My name is Diane Summers. I'm the Senior Advisor Demand for Immunization at UNICEF. It's my pleasure to take you through Module 9, Vaccine Acceptance and Uptake. By the end of this module, you should be able to 1. Describe a data-driven approach to planning, implementing, and evaluating demand strategies. 2. Describe strategic communication activities that promote COVID-19 vaccination and how to manage expectations. And 3. Explain how building trust and managing misinformation is key to achieving acceptance and uptake of COVID-19 vaccines. High acceptance and demand of any new vaccine requires careful planning, with attention across a range of areas including communications, community engagement, and the provision of quality services. COVID-19 vaccine presents significant challenges in vaccine acceptance because of the rapid pace of vaccine development, the use of new technologies, and prioritization of eligibility. There's been an unprecedented abundance of information and misinformation circulating. There is a need to support health workers with the necessary skills and capabilities to respond to any questions or concerns. Finally, a key guiding principle is to take stock of existing activities related to acceptance and demand and the broader communication platforms so that COVID-19 vaccine activities are aligned and integrated. There are 4 interrelated strategic elements. 1. Social listening, digital engagement, and misinformation management. 2. Risk communication and community engagement. 3. Empowering frontline health workers. 4. Crisis communication. Local social data on intentions to get vaccinated should inform all planning. To learn more about developing an integrated approach, please refer to the guidance on developing a national deployment and vaccination plan for COVID-19 vaccines. There are 5 key principles in demand planning. 1. Secure high levels of political support. You need to identify and engage the key stakeholders, influencers, and champions at all levels. Involve and inform them from the start. 2. Communicate in a clear and timely manner by working through trusted channels with quality and tailored content that will build trust and avoid any communication gaps. 3. Build capacity. Identify the needs and ensure they are fully integrated into the training curricula for health workers, community influencers, and mobilizers. In capacity building, it's important, in addition to core skills and competencies associated with the role and responsibilities of each function, that staff may also be trained in rapid data collection and use at the community level. 4. Use behavioral and social data for planning, monitoring, and evaluation. This data will guide planning, target strategies, and later be used to adjust the strategies with quality local data. 5. Integrate with broader technical plans. Coordinate with the necessary range of partners and stakeholders where possible using existing mechanisms or group. This will be essential for rapid and effective response to any vaccine-related events. A good monitoring framework can be used to detect changes in acceptance, perhaps due to misinformation, or an AEFI, or changes in programs. It's important to understand what people think and feel, to measure their confidence in the vaccine benefits, their confidence in vaccine safety. What is their perceived risk to themselves or to their patients? And seeing negative information. There are social processes. The influentials in a community who support vaccination. There may be vaccination norms or workplace norms. There is decision and travel autonomy, trust in vaccine providers, and confidence by health workers in answering questions. There is motivation, the individual's intention to get a COVID-19 vaccine, And after vaccination, what is their willingness to recommend a COVID-19 vaccine? There are practical issues. For example, knowing where the vaccine is available. What is the previous uptake of adult vaccination? Is it easy to access the vaccination? Is there a preferred site, like a health facility? And what is the availability of on-site vaccination and receiving the recommended vaccines? In this slide, we'll walk you through setting up an M&E framework in a practical orientation. In the columns, you'll see they're headed by domain and indicators, intervention, inputs, activity and outputs, and outcomes. We'll work from left to right. An indicator could possibly be, under the rubric What People Think and Feel, the percentage of health workers who are very or moderately concerned about getting COVID-19 vaccines, or percentage of health workers who are very or moderately concerned about giving COVID-19 vaccines to their patients. Interventions could be educational campaigns or informational posters, letters, materials, or group session to highlight the disease and the importance of the vaccine. Inputs could ensure that they are designed appropriately and the development of all educational materials are done on time. There could be a development of a plan for dissemination of materials to the target audience. Activity and outputs could include materials ready on schedule, pilot tested, revised and ready for rollout, and materials disseminated according to the plan. Finally, outcomes. Greater proportion of health workers who accept and trust COVID-19 vaccine efficacy and safety. A greater proportion of health workers who are knowledgeable about COVID-19 vaccine than the baseline. Or a greater proportion of health workers who are confident in their ability than the baseline. Countries will need to establish or strengthen networks and protocols for providing ongoing communication on COVID-19 vaccines. Examples of the type of information to share in order to build public awareness and trust include the vaccine development processes, evidence on vaccine benefits, their safety and risks, vaccine characteristics including the number of doses and the schedule, manufacturing constraints. We know that there will be limited initial availability of the vaccines. So as communicators, we need to manage public expectations and respond to questions of equity of distribution. And finally, details on eligibility of prioritized populations for vaccination and the rollout process. And both those last 2 points can be found in more detail on the allocation framework on the WHO website. Specialists may gather information on various target populations by researching what they may already know about these populations, using social data, administering surveys, and conducting focus groups. Key activities to supporting ongoing communications include analyzing the target populations and segmenting primary and secondary audiences, developing and pre-testing evidence-based messages which are grounded in behavioral sciences and tailored to targeted populations, identifying the best channels, whether they're media, as in the sense of traditional media or social media, for sharing vaccine information to build public awareness and trust. Consider that you hire a specialist to gather and synthesize information to guide strategies and targeted communications. Establish a transparent and routine communication on the status of rollout plans to stakeholders and the public. Have an advocacy plan, including training journalists as key advocates in the response. Training and briefing health officials and stakeholders to ensure they support vaccination activities is key to creating an enabling environment. And finally, training and empowering frontline health workers. And this is an important element of a good communication plan and is detailed as a separate element in this presentation. Engage with trusted sources. Develop and share information in tailored local languages. Partner with national and community civil society organizations, faith-based organizations, and non-governmental organizations. Work with communities, religious and influential leaders to deliver messages. Finally, empower community leaders. Misinformation management is a central element in COVID-19 vaccine demand planning. Gauge the amount and types of misinformation or vaccine critical messaging being spread in a country. This may require a specialist like a social analyst to guide plans in this area. Establish a protocol for routinely tracking misinformation. This can include a social listening strategy for monitoring conversations and concerns. Consider preemptive communication interventions to inoculate against misinformation. Be prepared to combat misinformation. Strategies may include advocacy campaigns, targeted communications, training and support for health workers to respond to concerns. This links with the next strategic element on crisis communication. Empowering frontline healthcare workers is essential for successful COVID-19 acceptance and uptake. Why? Well, it's important that health workers accept vaccines because they are the first adopters and have a key influence on clients to vaccinate. They are also influencers in the community. They can be frontline advocates, but they also can be susceptible to misinformation. They will have to manage difficult conversations with those clients who are not eligible for vaccination or who are vaccine hesitant. What needs to happen? Communicate adequate technical knowledge about the vaccine, address their concerns and questions, for example, about the new technology or platform for the vaccine, equip them with communication and listening skills and tools to deal with the vaccination rollout process, misinformation, and hesitancy. How? Conduct training and skill-building exercises, develop and provide FAQs, decision-making tools, and job aids, develop and provide tailored messages to reach diverse communities and target population, and establish a mechanism to collate and share early experiences, concerns, and successes. Prepare for any vaccine-related events and escalating rumors or misinformation. Expect heightened public scrutiny of any COVID-19 vaccine adverse event. Preparedness plans will need to be in place to ensure a timely and effective response to any event. Such a plan should include details of the coordination groups, their roles and responsibilities, named spokespeople, as well as key stakeholders to keep informed, messaging and channels for dissemination, particularly those channels most trusted. Plans should be linked to other coordination groups and mechanisms, especially with the AEFI teams, to agree on how to communicate safety signals, or the GACS, Vaccine Safety Communication Plan. It is also recommended to preemptively communicate on safety systems, how they work, and potential limitations, so that when signals happen, communities are primed about how to interpret this information. A crisis communication core team should be established. This team would be responsible for coordinating and managing crisis communications with the following key functions: draft SOPs, standard operating procedures, for managing crisis communications, content and guidance for responding to rumors, misinformation, and AEFIs, key messages with one voice across programs and stakeholders, media training and spokespersons, and finally, social mobilization and communication activities. COVID-19 vaccine introduction presents a unique set of difficulties, making it essential to step up vaccine demand planning and implementation using local data. A data-driven demand plan should be drafted, ideally before the vaccines are introduced or at least as soon as possible, and that it covers the following elements: ongoing communication and community engagement, misinformation management, empowering frontline healthcare workers, and crisis communications. 5 main requirements for developing a successful demand plan include securing high-level support, disseminating clear and quality messages, timely capacity building tailored for the different roles and functions, using data for planning, monitoring, and evaluation, and integrating with broader technical plans. The demand package for COVID-19 vaccination includes support to countries with an integrated package of resources to promote acceptance and uptake of COVID-19 vaccination. This is the demand planning package. It starts with listening to and understanding target populations to generate social and behavioral data on the drivers of uptake and to design targeted strategies. The social behavioral drivers assessment. It builds trust and acceptance of the vaccines through engagement of communities and civil society organizations, particularly for vulnerable and target populations, risk communication and community engagement guidance. Equips health workers with the requisite knowledge of COVID-19 vaccines and skills for effective communication with target populations and communities. Guidance and frequently asked questions tailored for health workers. Prepares countries to respond to AEFI reports and mitigate crises of confidence. GAC's Vaccine Safety Communication Plan. Builds a supportive information environment, guards against misinformation through integrated misinformation management, linking social listening and analysis with online and offline risk communication and community engagement, and advocacy. Field Guide to Misinformation Management. Thank you all for listening to Module 9, and I want to thank also the members of the CRAD, Country Readiness and Delivery Demand Working Group, for their inputs.